One of the most common questions patients ask me in clinic is this: did stress trigger my autoimmune disease? Many people notice their symptoms begin or significantly worsen during periods of emotional stress, burnout, poor sleep, major life events, work pressure, bereavement, relationship difficulties, illness, or prolonged anxiety. Some patients develop autoimmune symptoms after an intensely stressful period and naturally begin wondering whether stress may have played a role. In this video, I'm going to explain what we currently understand about the relationship between stress and autoimmune disease, how stress affects the immune system, whether stress can trigger flares, and why the topic is far more medically relevant than many people realize. I'm Dr Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology, London. Let's start with an important point. Stress itself does not directly cause autoimmune disease in a simple, straightforward way. Autoimmune disease is extremely complex and usually develops due to a combination of genetic susceptibility, immune system dysregulation, environmental triggers, hormones, infections, and other biological factors. However, stress absolutely can influence the immune system, and there is increasing scientific evidence showing that chronic stress may contribute to immune dysfunction and inflammatory activity. This is why many patients genuinely notice a relationship between stress and their symptoms. Now, what actually happens in the body during stress? When we experience stress, the body activates what's known as the stress response system. Hormones such as cortisol and adrenaline are released. In the short term, the system is actually protective. It prepares the body to deal with danger or challenge. Heart rate increases, alertness rises, blood pressure changes, and energy is redirected towards survival mechanisms. Short bursts of stress are a normal part of life, and the human body is designed to handle them reasonably well. The problem occurs when stress becomes prolonged or chronic. Long-term stress can begin affecting sleep, immune regulation, hormone balance, inflammation, energy levels, mood, pain perception, and recovery. Over time, the immune system may become dysregulated. Inflammatory pathways may become more active. The body essentially struggles to maintain balance. This is where things become particularly relevant in autoimmune disease. Now, autoimmune diseases occur when the immune system mistakenly attacks the body's own tissues. In rheumatoid arthritis, inflammation affects the joints. In lupus, inflammation can affect multiple organs. In psoriatic arthritis, inflammation affects joints, tendons, and skin. In inflammatory spinal arthritis, inflammation affects the spine and surrounding structures. These conditions involve abnormal immune system activation, and stress may influence how active these inflammatory pathways become. One important thing many patients notice is that stress often seems to trigger flares. Patients commonly describe periods where symptoms worsen dramatically during emotionally difficult times. Joint pain increases, fatigue becomes overwhelming, sleep worsens, brain fog increases, stiffness becomes more severe. These experiences are incredibly common in rheumatology clinics, and importantly, this does not mean symptoms are psychological or imaginary. The immune system and nervous system are closely connected. Stress creates genuine physiological effects inside the body. Now, another important topic is sleep. Stress and poor sleep often go hand in hand, and sleep is critically important for immune regulation. During healthy sleep, the body repairs and regulates many biological systems. Chronic sleep disruption can increase inflammatory activity and worsen pain sensitivity. Many autoimmune patients notice their symptoms become significantly worse after periods of poor sleep or exhaustion. Now let's talk about fatigue, because this is another major area where stress becomes important. Fatigue in autoimmune disease is not simply being tired after a busy day. It can be profound physical and mental exhaustion. Chronic stress places enormous strain on the body and nervous system. When stress combines with active inflammation, patients may feel completely drained. This is one reason stress management becomes an important part of overall disease management. Another interesting area of research involves the nervous system itself. Chronic stress can keep the body in a heightened fight or flight state for prolonged periods. The nervous system becomes overactivated. Pain sensitivity may increase, muscles remain tense, recovery becomes more difficult. Patients often describe feeling permanently wired, anxious, or unable to fully relax. Over time, this can worsen both pain and fatigue. Now, it's also important to recognize that receiving an autoimmune diagnosis is itself stressful. Many patients are dealing not only with physical symptoms, but also uncertainty, fear, frustration, financial pressures, work limitations, and concerns about the future. Chronic illness can place enormous emotional strain on people and their families. This emotional burden can then contribute further to stress levels, creating a difficult cycle. Now, another common question patients ask is whether reducing stress can improve autoimmune symptoms. The answer is often yes, although it's important to be realistic. Stress reduction alone is not a cure for autoimmune disease. Patients still often require proper medical treatment, including medications, monitoring, and specialist care. However, improving stress management, sleep, recovery, and overall well-being may absolutely help reduce symptom burden and improve quality of life. Exercise is another important area to discuss. Gentle, regular exercise can have powerful effects on stress regulation, mood, sleep, energy, and inflammation. Many autoimmune patients are understandably worried exercise may worsen symptoms, but carefully managed movement is often extremely beneficial. The key is pacing and consistency rather than extreme exercise programs. Now, let's briefly discuss mindfulness and relaxation techniques because patients ask about these frequently. Techniques such as meditation, breathing, exercises, yoga, mindfulness, counseling, cognitive behavioral therapy, and psychological support may help some individuals manage stress more effectively. Again, these approaches are not replacing medical treatment, but they may support overall well-being and symptom control. Diet is another area that often overlaps with stress. During stressful periods, people may sleep poorly, eat less healthily, consume more alcohol, become less active, and struggle with self-care routines. These lifestyle changes may further worsen inflammation and fatigue. This is why holistic management becomes important in autoimmune disease. Now, another very important message is this. Patients should never blame themselves for developing autoimmune disease. Many people feel guilty and start thinking, did I cause this by being stressed? Autoimmune diseases are complex medical conditions involving many biological factors. Stress may contribute in some individuals, but it is not simply a matter of somebody thinking positively or avoiding stress. Good medical care remains essential. Another thing I often explain to patients is that stress affects everybody differently. Two people may go through similar life events but have completely different immune responses and symptom patterns. Genetics, hormones, sleep, infections, previous health conditions, resilience, coping mechanisms, and many other biological factors all influence how the body responds. Now, one particularly important concept is pacing. Many autoimmune patients experience cycles of overdoing things during good periods, followed by crashes afterwards. Patients often push themselves hard when symptoms temporarily improve, then experience exhaustion and flare-ups afterwards. Learning pacing, recovery, and energy management can be extremely important for long-term symptom control. Now, should stress be taken seriously in autoimmune disease? Absolutely. Modern medicine increasingly recognizes the close connection between the immune system, nervous system, sleep, inflammation, and emotional well-being. Managing autoimmune disease effectively often involves far more than simply prescribing medication. It requires understanding the whole patient experience. Now, let's summarize the key messages. Stress does not directly cause autoimmune disease in a simple way, but chronic stress can influence the immune system and inflammatory pathways. Many patients notice stress-related flares involving increased pain, stiffness, fatigue, and exhaustion. Poor sleep, nervous system overactivation, burnout, and emotional strain may all worsen symptoms. Stress management alone is not a cure, but improving sleep, recovery, pacing, exercise, and emotional well-being can often significantly help overall symptom control and quality of life. Most importantly, autoimmune disease is real biological illness, and patients should never blame themselves for developing these conditions. If you found this video helpful, make sure to subscribe for more content on autoimmune disease, inflammation, and joint health. And if you're concerned about the symptoms or would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.